started, we'll talk about some COVID-19 vaccine updates just briefly before we hop into motivational interviewing. So some exciting things have happened in the vaccine space over the past 2 weeks. First off, Pfizer-BioNTech gained FDA approval to expand their EUA to include adolescents. Moderna and Janssen are still in the data collection phase of expanding their EUAs, but we can expect them to do something similar in the near future. So Pfizer-BioNTech's expansion now includes adolescents aged 12 to 15, and during their clinical trials, they actually found that the vaccine demonstrated 100% efficacy and robust antibody response and showed evidence to warrant that EUA expansion. So they'll continue to monitor the clinical trial participants in that 12 to 15-year-old age group, and they'll begin trials for younger children aged 6 months to 11 years. As I mentioned, Moderna is also working on clinical trials for adolescents aged 12 to 17 because right now the Moderna vaccine is only available to those 18 plus. And the Moderna vaccine within that 12 to 17-year-old age group is demonstrating 96% effectiveness. Another exciting thing that happened was that Pfizer-BioNTech submitted their application for FDA approval, or at least started to. So on Friday, May 7th, Pfizer announced that they are initiating the biologics license application, or BLA, with the FDA. So some of you may have heard on social media or in other channels that some people are hesitant about getting the vaccine because the vaccines don't have full FDA approval. And that's exactly what this biologics license application is. So super exciting news on that front. So Pfizer-BioNTech will do a rolling submission of the FDA approval for their vaccine for ages 16 and older. So they'll be submitting data every so often as they gain it and all of that. They will get a priority review and a goal date for an approval decision, and that will be made once that BLA is complete. So what does the timing look like for all of that? The chief executive of Pfizer came out and said that they look forward to working with the FDA to complete the rolling submission, and they support their review with the goal of securing full regulatory approval of the vaccine in the coming months, which is really exciting. And both of these two new vaccine-related news are really going to help with our herd immunity, which I think is what Kim is going to talk about next.
Yeah, thanks, Elena, and welcome everybody. According to the CDC COVID data tracker, so as of today, approximately 60% of the US adults have received at least one COVID-19 vaccination. Say that's pretty good news. And this tracker also lists with percentages the multiple COVID variants that are circulating globally and including here in the US. COVID variants, they're put into 3 classifications. There's a variant of interest, concern, and high consequence. And there's multiple VOIs out there, but there's currently 5 variants of concern. And for here in the US, it's the B.1.17. This is that UK variant. This is by far having the greatest impact here in the US. It's about 50% more transmissible, but it does have some minimal impact, but it has minimal impact on the effectiveness of our current COVID vaccines. But what's worrisome is reaching herd immunity before a COVID-19 variant becomes classified as a variant of high consequence. It's at this classification, our vaccines become ineffective and we have severe disease and an increase in hospitalization rates. So reaching herd immunity by vaccination will greatly reduce the chance of COVID mutations and keep us from deadly variants. But, time is critical as more mutations present themselves. Okay, so in our first vaccine event, we discussed how COVID vaccines are over 90% effective in reducing hospitalization, and death. But there's another significant reason to vaccinate, and it's a range of symptoms, and it's referred to as long-haul COVID-19 or PASC. It says PASC. So that's post-acute sequelae of SARS-CoV-2 infection. Excuse me. It encompasses a wide range of symptoms and clinical findings that can occur in people with varying degrees of illness post-infection. And this includes patients who had mild or asymptomatic infection. And these people continue to experience lingering symptoms months after the initial diagnosis, and these effects can overlap with multi-organ complications. So for some, this phenomenon has greatly impacted their social and economic welfare. People have lost their jobs due to these like debilitating symptoms, like fatigue, memory impairment, shortness of breath. And they just find themselves frequently seeking healthcare for their multiple long haul symptoms. So since there is such uncertainty surrounding the sequela of symptoms and its permanency of them, it's the leading intervention in preventing this and possible PASC would be to get vaccinated. So that concludes our COVID-19 updates. So now we're going to move to the motivational interviewing portion of our presentation. Okay, so what is motivational interviewing? Motivational interviewing is a collaborative, person-centered, guided method designed to elicit and strengthen motivation for change. Okay. And here is a list of the six key concepts of motivational interviewing. And I'm going to do a deeper dive into ambivalence, empathy, and reflective listening. Oftentimes, people are ambivalent to behaviors they seek to change. A patient, a staff member, maybe a family, they might simultaneously feel two ways about changing their behavior. Sometimes they want to make a change while also feeling inhibited to do so. So it's important to recognize that and lean into it that way. So, we're hearing that there's so many people in the wait and see category on whether they're going to get a vaccine or not. So things like pressures and mandates, they can actually create resistance. Maybe someone really wants to get back to normal and knows that the vaccine is the answer, but is really worried about not knowing about the ingredients in the vaccine. So you could lean in with that as your motivational, as one of your motivational strategies. Listening with empathy. That's the foundation of motivational interviewing. Empathy is an active interest in an effort to understand the person's internal perspective. It's not sympathy or pity or identification. And reflective listening is a statement that mirrors what was said or meant. It demonstrates empathy, it shapes direction of the conversation, and you get to choose what you want to reflect on. So reflective listening offers the opportunity for the other person to expand or correct or emphasize what you interpreted it. So it could be simple, a paraphrase, maybe even just a nod, something to say that you understand. So that's ambivalence, empathy, and reflective listening. Now, Elena, could you expand a bit more on change talk?
Yeah, thanks, Kim. So change talk is when you're able to recognize the other person's own argument for change. So you want to look at importance. How important is the change for the person that you're speaking with? Or what are the reasons that it's important to them? You can also focus on confidence. How confident are they in the success of the change? So one way to do that is by using change talk rulers. So you'll see here you have a scale from 0 to 10, and you could ask the person you're speaking with that might be vaccine hesitant about how important is it to you to get back to normal, or how confident are you that vaccines are safe and effective, or how ready are you to make the decision to get vaccinated. Now, the ultimate purpose is to evoke change talk. So when you ask them one of those questions, you'll ask them from 0 to 10 where they lie. So if you ask someone, how confident are you that vaccines are safe and effective? And they told you that they are at a 5, they're not really sure, but they think they probably are because they know a lot of people that got vaccinated. Well, then you could use that ruler again and ask them to tell me about that 5. Why did they choose that 5? They kind of just explained that about they know a lot of people that got vaccinated, but they're not really sure how safe and effective they are because they haven't been around for all that long. So then you could ask them, why are you at a 5 and not at a 3? And maybe they explain that a little bit more and say, again, well, I know a lot of people that got them. They didn't feel 100% for about a day with a sore arm, and maybe they were fatigued, but I still don't know exactly what's in them. So that's why. Then you could then say again, what would have to happen that you move from a 5 to a 7, and have them explain those things to you, because sometimes it could be something like, well, if they had that full FDA approval, then I would be more interested in getting the vaccine. And now you're equipped with the information to let them know, well, Pfizer just went after full FDA approval and they should have it in the coming months. So having them explain things on a ruler or on a scale like this, and then taking it back and asking these questions so that you can really understand where they're coming from, will help you evoke some of that change. Another strategy is the ORS strategy. We're going to get a little bit more into open-ended questions and affirmative statements on the next couple of slides, but they're the first 2 pieces of the ORS strategy. So you have open-ended questions, things like, how are you feeling about the vaccine? And there's a whole list that you could kind of follow to start a conversation with someone. You have affirmative statements, and these are really important because they're going to help you make sure that you don't get combative. Sometimes people can say things that you don't agree with when you're having these conversations. And we really need to recognize and support their values, perspectives, strengths, and efforts, and promote that collaborative relationship. So you can see there as well, there are some examples of some things that you might use. When we get to reflections, this is where you use a reflective listening. You respond thoughtfully by paraphrasing what they said to you. You validate their point of view, and your ultimate goal is to confirm they have been heard and acknowledged. So things like, sounds like you're feeling worried about not knowing the ingredients of the COVID vaccines and things like that. When you get to summary statements, this is where you use statements that recount and clarify what the person said. This is where you're going to identify specific areas that they can act on. And the ultimate goal of this is to clearly and respectfully conclude the conversation. So here are some phrases that you could use for that as well. You also said you will talk to your friends and family about getting vaccinated and see if any of them have new information to share with you. And then lastly, you can offer information with permission. So you may offer your own experience and or information, but you always want to ask for permission. And the goal here is to foster openness and connect based on respect, not to persuade or convince. So this is where you would say, I was also afraid, but I ultimately decided to do it. Would it help if I shared my reasoning to get vaccinated, or what helped me? And if they say yes, then you can kind of share your own experience. But if they say no, then that's okay. And you can leave it there. And maybe there'll be a different opportunity in the future to revisit some of this with that person.
Okay, so in the previous slide that you just saw, Elena explained how open-ended questions can evoke a two-sided dialogue. Using this format during an interview, it's likely to keep both parties involved and engaged and interested. Start with words, such as how and what, and use short phrases to evoke a response. Give me an example of that. What was it like? Just tell me more about it. This is this helps more than the question, do you know about the potential side effects of COVID vaccines? This only needs a yes or no response, and that could shut the conversation down, making it, maybe more difficult to get to the affirmation step. And here, these are just a few more additional open-ended questions. What would what would help you feel more ready to get the vaccine? What are you worried about when if you don't get the vaccine? Once you understand the individual's barriers and concerns and expectation, then you can move on to affirming statements.
Thanks, Kim. So now we're going to dive just a bit deeper into those affirmations. So I mentioned that these are really important to have in your arsenal so things don't become combative. Again, you might not agree with everything the person you're talking to is saying. So during your conversations, you want to have some of these phrases ready to go. So these are going to help you recognize and support their values, their perspectives, their strengths, and their efforts. It promotes that collaborative relationship. They enhance self-efficacy and confidence, and they're not just praise or cheerleading. So some of those phrases that you could have in your back pocket when you're talking with someone might be, you've done a lot of research, or I can tell that you've been thinking a lot about this, or you've really been weighing this decision. So utilizing these when you're talking with someone and maybe they're saying something that you don't have the same feelings towards could help continue the conversation and just show that you respect them and that you're listening carefully to them.
Okay, so we've learned about the core communication skills through OARS, and now we're going to demonstrate how to use these skills in the 4 processes of motivational interviewing, and we're going to do this during a role-playing activity. As Elena and I go through our role-playing activity, we're going to stop to inform the audience which process we're doing during the conversation with a brief explanation. As we go through the steps, see if you can identify any OR skills and how the conversation fits into the 4 processes of motivational interviewing, which is engaging, focusing, evoking, and planning. Okay, so we'll start here with our role-playing activity. So the first part is engaging. Okay, so this is where we're going to develop that relationship. I'm going to develop a relationship with Elena and listen and to try to figure out what's going on here. Well, hi, Elena. I heard you're not interested in receiving the COVID-19 vaccine. Let me start by, saying that this is, totally your choice and I respect your wishes.
Oh, thanks. Well, I did expect an argument.
Oh, you know what? You're not going to get one from me, but if it's okay, I would love to hear more about your thoughts on this subject.
Sure. I just think this whole pandemic has been blown way out of proportion. My friend got sick, and after a few days, he was just fine.
So you don't see the need for a vaccine if you can easily recover?
Yep.
Okay. All right. Well, tell me more about your concerns. Is it more that you don't want unnecessary medication or that you're worried about the safety of the vaccine?
I take medication all the time, and I've gotten the flu shot before. I just haven't worried too much about the side effects because I'd already decided that I wasn't going to get the COVID-19 vaccine.
Okay. Well, it almost sounds like you've taken a stance based on a general principle. You think people are making a big deal out of this and you don't like it.
I don't know, maybe. I read all the time on social media how this is a lot of fake news, and I just don't want to buy into it.
So now at this time, we are going to go into the second process called focusing. This is where the major concern is addressed. So I want to reiterate again, It's totally your choice, and I don't want to pressure you. I was just wondering if it may be helpful for us to briefly discuss the pros and cons outside the political realm, so you have all the facts completely objective-like.
Sure, there's no harm in that.
Good, thank you. I appreciate how open-minded you are, and I promise not to take up much of your time. All right, so now that we have our major concern has been focused, now we are going to evoke. So this is the heart of motivational interviewing. And this is where you're going to see a lot of the ORS skills, ORS communication skills will be used here. So what do you know already about the short and long-term risks of COVID-19?
I know that it's riskier for old people and people with underlying conditions, and those people are sometimes being hospitalized for having difficulty in breathing. But I don't fall into either of those categories.
Okay, you're exactly right about those populations being high risk. Can I share with you some information about the rates of people like you that get sicker than your friend?
Sure.
Okay, Elena, the number of like 30 to 49-year-olds that are being hospitalized for severe COVID has significantly increased, while the numbers for the older people, 65 and older, have dropped. I mean, many of the older population, they've received the vaccine, which could be contributing to the decrease in the numbers. And, you know, it shows us that we're saving lives. There's a COVID variant in Michigan that it originated. This is one that originated in the UK, and it's now the prevalent, it's the prevalent COVID virus, and it's 50% more transmissible, and it actually can produce more severe COVID. Now, I hope I didn't dump too much on you at once. What do you make of all that?
Well, I don't want to get severely ill, and I really wasn't aware that there was an increase in younger adults being hospitalized, but I did hear the COVID variants might cause some issues.
Okay, you mentioned you hadn't researched the risks of getting vaccinated yet. Should I share just a brief overview?
Sure.
Well, most likely you're going to end up with a sore arm, but you might have some side effects that could last just maybe 24 to 48 hours. And that could include chills, fatigue, fever, maybe a headache or some joint pain. Any thoughts about the risks of the vaccine versus the benefits it offers from getting sick?
I've just been so irritated about the whole issue. I guess I never really considered it that way. I just expected that at some point I was going to get COVID and then I was just going to get over it.
Okay, so now we're moving into the planning phase. We're going to summarize and we are going to commit to change and then a plan for action. Well, we're going to hope to commit to a change, right? All righty. So it makes sense that you felt this way, but I can tell that you're a bright and you're thoughtful. Although this is a different perspective to consider. Before I let you, get out of here, I'm curious. What are you thinking? Where does this leave you?
Well, it gives me some new information to think about. I'm just still not 100% sure that I want to get it.
Okay. Well, I'll tell you what. If you decide that the benefits outweigh the risks, please feel free to reach out. And if you do need some help getting a vaccine appointment, or if you have any other questions, I'm here for you, Elena.
Thanks, Kim.
Okay.
Well, thank you everyone for walking through that role-playing exercise with us. We hope that you're able to kind of pinpoint some of those tools that we showed throughout the presentation. And sometimes your motivational interviewing strategy might end like that, but you've left it open for future conversation, and you've held a respectful conversation throughout the whole entire time. So hopefully those people feel comfortable coming back and asking additional questions if they ever have them. Just curious, has anyone had any successful like talking points that you've used or things that you've heard from friends or staff or coworkers about things that they weren't educated enough on, that maybe once you gave them that knowledge, they felt more comfortable to get vaccinated? If that's the case, you can put it in the chat or you can unmute yourself and tell the whole group.
You know, Elena, one thing I've noticed in my experiences with people that, you know, don't want to hear, sometimes they don't want to hear a lot about it. It is important to, you know, ask nicely permission, you know, hey, I know that, yeah, tell me about that. But then you have to because if you load too much on someone, they don't want to hear about it. That could definitely turn someone off.
Definitely. Yeah, I continue to see too, more and more, the more I go out and about, like random people are asking me. So I was checking out at a store on Saturday and someone asked, like the store associate asked me if I was vaccinated. And I said, yes, I am. And so I asked her back, I said, are you? And she said, no, not yet. My dad is a little concerned about it, but I'm going to get vaccinated. I know it's the right thing to do. And I was just interested to see, because like that, she's the type of person that might need conversations like that to talk to more people who are vaccinated, to really push herself to go in and make the appointment and things like that. And I just mentioned my whole family is vaccinated and I feel really comfortable now knowing that we're all a little bit safer. So I think being open to have conversations like that, and not everyone feels comfortable answering that question. And I wasn't going to ask her, a person that I didn't know, but the fact that she asked me and felt comfortable enough, I felt more than comfortable sharing that I was vaccinated and that I know lots of other people that are vaccinated as well. So I think having those conversations is going to be a way that we can help other people feel more comfortable getting vaccinated as well. All right. Well, I think we'll hop over into some reminders really quickly, and then we'll open up the end for any questions or anything that anyone wants to bring up at the end of the call. To get us started, I am going to place a link to an evaluation for this event and the series of events. So if you'd like to take that for us and let us know how we're doing, and if you have any ideas for future events, we'd appreciate those. Put that in the chat. So the first thing, we always want to conclude with where to get vaccinated. So if you or someone you know is looking to get vaccinated, the COVID vaccine finder is a great place to check. They'll identify areas or locations where you can get vaccinated and what type of vaccine they have. So definitely check that out. If you're talking with someone who isn't maybe so tech savvy, they can always call one of these hotlines. Each state within our region does have a COVID-19 hotline, and they can help you get set up with a vaccination appointment.
Yeah, and also, if you haven't done so, please confer rights to superior health. And what we're regarding to is through the National Healthcare Safety Network, or NHSN. We've had some recent changes in vaccine data that needs to be entered into NHSN. So besides conferring rights to superior health, that will also need to be done. So if you do need us for any help, you can confer rights, and we will also assist you with any instructions that you may need in the process of getting a level 3 SAMS grid card that you're going to need to do some of this data entry. So we're here for you if you need that. Also, the organizational assessment. You may have seen, man, we've had a lot of e-blasts go out to invite all of the organizations to complete your organizational assessment through Superior Health's portal. It's called Key Metrics. And really, your voice is so critical in helping us with knowing what you need help with. This organizational assessment, your answers, then we can tailor the needs to your needs. We can tailor what you need and give you interventions and ideas and what have you to help your team out.
With that, yeah, if you have any questions, you can always feel free to speak up right now, or you can email either Kim or I. Our emails are there on the screen, but we'd love to open it up if there are any questions. If anyone, again, would like to share with the whole group any strategies that you've used that have helped anyone you know make the choice to get vaccinated, that maybe could help some other people have those conversations as well, we'd love to hear them.
You know, one other thing, Elena, I was just thinking, I've noticed that people will ask me, did you get vaccinated? And they want to know why. I noticed that people that I've known, that they want to know why you did it. And I think that might be, again, them leading into a different way of motivational interviewing on like, should I, wonder why she did it? Because if that sounds good to me, or maybe she can add to my list of reasons I do or I don't, that will either solidify or make my wishy-washiness go one way or another.
Definitely agree. Right. Well, I'm not hearing anything from anyone, so I think we can end the call a little bit early. So we just really appreciate all of you attending today's session, and if you attended the previous two sessions. If you're not already on Superior Health Connect, you can definitely check your email to look for an invitation to that, or reach out to either Kim or I, and we can help you get onto our Superior Health Connect website. That's where, we'll be posting lots of great articles and resources, recordings from previous educational opportunities like this right within that system. So thank you all again for joining us, and we will talk to you all soon.